The idea was to kind of showcase some of the excellent research that was going on here at the institution. It started in a small library, actually just below here, where they had about 50 people who attended some presentations by the scientists here. And then over the years, we've gained momentum. It's increased now where we go to Kerner Hall and have almost 1,000 people in attendance.
How does the whole competition work?
We put out initially a call for applications, and we get basically people applying for the positions to be on the Angel's Den, and we cut it down from usually about 20 to 25 down to a dozen, and then those dozen have kind of some internal interviews, and we figure out among those which are the best 6, and those are the 6 that we earmark for being in the competition.
Well, I am a nanotechnologist. So my lab developed technologies in order to design effective therapies for people, and we focus on vulnerable population. One of those is the pregnant population. We are developing the first of its kind targeted delivery to treat the mother by delivering therapies exactly where they should go, and at the same time protecting the baby from this therapy. We design what we call nanoparticles. These are very tiny particles when used and to wrap the medicine and to change the composition of those particles, we are able to get those medications to exactly where they should be in the body. And by accumulating the therapy in the disease side, we make sure that the patient is getting healed or faster, but also other parts of the body do not really see this drug, which means that there are no side effects. And in case of pregnant women, this is even more important because there is another human being.
We created this artificial intelligence model called Assist TBI, which is basically an automatic triage, AI-based support tool to help neurosurgeons and emergency physicians decide when a traumatic brain injured patient needs emergency surgery. So there's an overwhelming volume and demand for neurosurgical consults and innumerable critically ill patients at a given time with a small amount of neurosurgical specialization. We've developed this here at St. Mike's using thousands of previous trauma patients, and we've deployed it here at St. Michael's Hospital in the emergency department. It's been a really big success for us. It functions as well as a board-certified neurosurgeon, and in some cases a little bit better.
St. Michael's Hospital Foundation, and Angel's Den have been a huge catalyst for us having momentum and building a team that's allowed us to actually get our idea off the ground. And so we're working actually with Ontario Health and other organizations to actually try and implement this to actually help the hospitals that need it throughout the community and throughout all of Ontario right now.
Why do you think that this is a good structure to kind of come up with these innovative ideas and changes to healthcare?
Because anytime you feature science and feature science to show the public how important it is, that's a good starting point. But it's also a really good funding structure for our scientists. I think we've had 86 presentations over the 11 years, but we have had some big successes out of that. Out of that, we've got over 30 devices. We've got intellectual property for 19 of those, and spin-off companies in 10 cases. So, if that's your metric, which is taking science and bringing it to society, that's a pretty good metric for it.